and introduce both of our speakers. So Beth Auten is the Health and Human Services Librarian at UNC-Charlotte, and Angela Jones is the Biomedical Information Specialist at Levine's Children's Hospital in downtown Charlotte. And with that, I'll have them kind of take it away.
All right, this is Beth. I'm going to go ahead and share my screen. And hopefully everyone can see. And I'll go ahead and pull up our slides. We already kind of went over this. So health literacy resources is what we're calling this. There's not a whole lot of information on these slides, but we can share them with you later. I think a lot of what we're going to do today is kind of live demo. And as in the course description, we're going to talk about kind of first of all, just general information literacy, how health literacy ties in with that, media literacy, how that ties in with it. Then some consumer health resources targeted more at patients and their families and patrons. And finally, some professional level health resources. So I saw some things about like how to complete a Prisma diagram in people's questions, and that's not really within the scope of what we're planning to go over today. We will talk about some of the professional level resources that are available freely online or through NC Live, but the focus is more on things for patrons, patients, families, and healthcare providers who want to provide information to patients. So the first thing I want to start with is just general information literacy and how health literacy ties in with that. So you're probably familiar with the ACRL framework for information literacy, and basically just how information is discovered, how it's produced, the value of information, how it's used in creating new knowledge, and how to use it ethically. And health literacy very much ties in with that. There's some things that are specific to how reliable health information is researched, collected, disseminated, and how it's translated into clinical practice, and also just how to be an informed health consumer and help other people do that. Angela probably has a better definition for health literacy, and I'm going to let her do that.
The way we describe it in healthcare is the degree to which individuals are able to obtain, process, and understand basic health information needed to make appropriate and good health decisions. Because that's your end goal. You want your patient to be able to understand the information so that they can decide what's the best course of action in their treatment or how they can make themselves better.
And so the first thing I kind of want to talk about is health information in mass media and even beyond, like health information that's shared in social media and how to evaluate that information. So something that my colleagues have worked a lot with at UNC-Charlotte are some steps for media literacy. You may be familiar with like the CRAP test and some other like rubrics for evaluating information in general. This is kind of specific to media, and there's some tutorials and things that go into more depth, but it's really simple. How to tell if what you read online is reliable. So the first step is slow down, and part of this is don't immediately share it. Don't be the person spreading misinformation or disinformation. And there's a difference between them, but we don't want to share either. The major ones that we want to focus on, especially when you're guiding someone who comes to you with a story that they read on the news or somebody shared something and they're concerned about it. Who wrote it? What's the evidence for it? Are they trying to convince you of something? Do they have the expertise and unbiased opinion to convince you of that, or no? And then looking around. So lateral reading means going outside of the source that you're looking at. I know a lot of traditional information literacy looks at like, what sources did they cite? Do they have external sources? Are they old? Are they reliable? This is actually going outside and looking at some of those sources and seeing kind of where this lies in the terrain of information. Do other sources conflict with it? Is there anything that supports it? Did it just come from out of thin air? So they're pretty simple principles. And I want to go ahead. I can't really monitor the chat as I'm doing this, but I'll go ahead and start with this kind of shocking thing in social media, because a lot of things that are widely shared they have shock value. They're things that make people concerned and upset. So infertility is a really sensitive topic to begin with. And so this whole thing about one of the COVID vaccines causing sterility in women, if that were really true, that would be really concerning. And so this was shared widely on social media. So first of all, in the chat, what questions would you ask if somebody came to you with this? And I'll try to take a look. It's going to be hard for me to monitor and talk at the same time. Are you able to hear me? Somebody says they're not able to hear me. Okay. So where did the article come from? That's a good question. So all we have, what's the source? Yeah, we don't have a link to anything, just an article from a physician who works for one of the big pharma companies. That's what we have to go on. Any other questions about this as you look at what facts is it based on? Yeah. When was it written? None of this is addressed in this post. So I'm guessing this is not something any of us would share, but was it a peer review? These are all great questions, and there's not an answer to them in this post. Yeah. So what happens when you look around? Just take a minute, go take a look wherever you would go to look for information on this, and tell me what you find. This one won't take very long. So you can put in the chat where you went. This one, I really just went to Google, and I don't know that it's one that we're going to refer to just because of all the advertising, but the first thing that comes up in the list is WebMD, why COVID vaccines are falsely linked to infertility. And there's a lot more. There's a whole lot more. So let's just go take a look. We'll come back to that Daily Mail story, because mass media stories are a little bit different than random information that people share on social media, but just go look for this. So there's some media stories. There's a story about confronting misinformation related to this. So we're not really seeing anything that supports this. And we could go to Pubmed or somewhere, but like this is AAFP, this is Family Physicians. So there's a lot of information out there. So some of those things are relatively easy to kind of dismiss. Now, here's another example. So this is a story in the Daily Mail, which is a British paper. There's a lot of advertising on the page, but it's another COVID story. So this one, people with blood type A are at greater risk of catching COVID-19 because the virus can bind more easily to their respiratory cells, study reveals. So what questions do you have about this? It's in their science and tech section. Any questions? Which study? So you would want to go look at the links in that. I had trouble finding it because it's the Daily Mail, but that would be a good question. So this one, where would you go, do you think, to see what's out there about this topic? Right, more than one study? Exactly. Is there a consensus about this that would lead to this being something that we actually need to be concerned about? Or is it something that's being researched? PubMed. And ultimately, that's where I would go to. So if you go to Google, you see a bunch of stories about this. Like, this is actually something that people are talking about. WebMD again, pushed up to the top, why blood type may matter. So if you do go to PubMed, before I come back to look further, because PubMed is going to be my looking further in this case. But if I go to PubMed, and it took me right to the advanced search builder because it knows me so well. But if I do COVID-19 and blood type, just drop that into a PubMed search. And I have it sorting by best match. And the first thing that comes up is this 2020 September article, Blood Type and Outcomes in Patients with COVID-19. So clearly there's actual research on this. I can look through the abstract. And this doesn't address that specific thing about respiratory cells, but there's this whole section about what this multi-center study found for different blood types. And there's several more like this that come up pretty high in the search results in PubMed. So this is really kind of an unresolved question, and you're going to see that. So oversimplification and a lack of understanding of medical research and the data that are gathered from it can lead to faulty conclusions, sensational headlines. So even be careful with that kind of thing. It doesn't mean that it's not true, but it means that it's probably more complicated than that headline that we looked at. And so, do any of you have examples of things that people have brought to you like this? Like a news story or something that someone told them anecdotally? I'm just checking the chat to see if there are any questions like that. One place that you could direct people if they need a news story fact checked or some of these fact checking websites, there's one specific to COVID-19 because there is a lot of misinformation out there. Government websites, which we'll circle back to in a little while. And then AP and Reuters, which are wire services. That's where a lot of the news networks, newspapers get their stories from, but they tend to be pretty unbiased sources of information. So if you can see like an AP or Reuters wire release, that might be a better place to look than on a news website. So I know somebody had a question about where do you kind of cut someone off when they're asking for information. And I promise this is a real example, but somebody asked about a patron who called about a rash that they had and they wanted advice about it. And Angela has input about this too, I know, and I'm going to kind of segue into her part of the presentation. But my thought would be, we don't ever diagnose things. We don't ever talk about prognosis. If somebody comes with a diagnosis and they want information about a therapy that they've been prescribed, what's out there, we can direct them to reputable sources of information, but we're not physicians, we're not healthcare providers, and it is okay to redirect somebody who needs information like that. And it's not just librarians. I got questions like this when I stocked vitamins and supplements at a health food store. People will go to people that they perceive as an expert for information like that, but we don't have to provide it. We can direct them to someone who can actually help them. And with that, I'm going to kind of, let me bring slides back up. I did put this evidence pyramid in here. Some of you may be familiar with this already, but this is kind of the hierarchy of health information. So down at the very bottom of this pyramid is expert opinion, and that's real experts, not somebody's aunt on Facebook. This is like a real expert. But if that opinion is not based on research, that's still going to be down at the bottom of this evidence pyramid. And then as you go up, things like a single case report or a case series, a number of people. And then all the way up at the top is sort of synthesis of evidence. Like if we're looking at a drug therapy and whether it's effective or not, a meta-analysis of multiple quality randomized controlled trials, like that's what would be up at the top of the evidence pyramid. And so just some awareness of that, like how health information is produced and how it's disseminated, and there are ways that it should be done, will help evaluate information, even when it's written at a mass media popular audience kind of level. And with that, I forgot about the slide. I'm gonna switch over and let Angela take over.
Beth, would you mind going to the next slide for me? I can't seem to pull it up. Thank you. We're going to talk about consumer health and consumer health literacy. And one piece of data that usually shocks folks is that 7 out of 8 people struggle to find, figure out, and understand health information. Most people assume that the reason people can't understand health information, that they have low health literacy skills, is because of learning disabilities, their inability to read. And that is actually not true. That is one barrier, but it is not the only barrier. Age is a barrier. We have found that more older people suffer from low health literacy skills. Language barriers. Sometimes the person, English is not their first language. They're here in the US. They may not even be able to speak or read English at all. So that can be a huge barrier to understanding health information. Learning disabilities, obviously, little to no education. Vision. Someone who has poor vision is often unable to read either on a computer screen or on a document in front of them because they have poor vision. A lot of times, particularly patient handouts, they love to give you this single sheet handout and it's written in this teeny tiny writing, and a person who has vision problems may not be able to read it. And stress, particularly when your loved one, your child is ill, you're going to be stressed out, and your ability to absorb and process information is greatly diminished. Studies have shown that health information really needs to be written at a 5th and 6th grade reading level. And it doesn't matter whether you have a GED or a PhD. That's the level it needs to be written at for patients and caregivers to understand it. Unfortunately, the average reading level for most patient handouts is a 9th to 10th grade. So you can see there's a huge gap between where we are and where we really need to be. A lot of websites, a lot of vendors are getting much better about producing materials that are written at a lower grade level, but there's still a long way to go. And the more complex the health problem, such as a genetic disease, the more complex the information is and the harder it is to get down to that 5th and 6th grade reading level that it needs to be. You will see most things for genetic diseases written at a college level. And as you can imagine, that can be really, really difficult for someone to process. And most, unfortunately, healthcare providers feel like they need to assume that we all understand. Oh, they understand. But that's not where the research goes. The research says that you need to assume the opposite, that they don't understand. Again, because of any number of factors that they just can't get it. We've had a nurse who recently had a baby, and she's handed all of these handouts on this new baby, and she got home and she said, it was like reading Greek. I was like, and I'm a nurse and I'm supposed to understand it, but I haven't had any sleep because my baby's colicky. She's up all the time, sleep deprived. And it was like reading another language. I couldn't grasp it. So that's kind of where we are with health information and trying to get things for patients and caregivers that they can easily understand. One of the things I hear often in my library is, you've been the most helpful person. And I know that their care team is doing a great job, but they didn't understand what they were being told. And someone comes along and helps them find information or gets them information that they can start to understand. Their stress is a lot lower, they can make better decisions, and it's just a much easier process for them. We can go to the next slide. Thank you so much. I only put 2 resources here because these really are my go-to resources nearly 99.9% of the time. Medlineplus.gov, if you haven't used it, it really should be your go-to. This is the National Institute of Health and the National Library of Medicine's website. It is really its own search engine. It's the only site you really need. It's super, super easy to navigate. So if you have a user who is not very computer savvy, it's really, really easy for them to find information. And you can look by health topic, you can type in, you can do a browse search by health topic, or you can actually type in what you're looking for. As you can see in the top right corner, it can easily switch the entire website to Spanish. So if you have a Spanish speaking person who wants to search in their native language because that's easier for them, you can easily split the whole site over into Spanish for them, and they can search the website that way. And then flip it back to English when you need to. It's just, when you go into, let's type in, for example, childhood asthma. It's actually its own topic. And as you can see, where do we go? There we go. If you scroll, asthma in children is its own topic. And the great thing is it's just really a one-stop shop. They can get basics, they can get treatment, they can get symptomology, they can get just a quick little summary if that's all they want. Diagnostics, they can get, even there are often links to research, which is coming from Pubmed. If they're interested in that, clinical trials, any related issues, they will, in this instance, we're looking at children specifically, but you can also, they're often divided by, is there something that's different for the elderly patient? Is there something that's different for women, children? So, and then at the very bottom, there's usually patient handouts that are real easy to read, and a majority of them are in Spanish. Another great thing about Medlineplus is they do have other languages other than Spanish. However, unfortunately, it's usually more your kind of basic health terms, your basic health information, not more complex things like cancer. That kind of information is still really, really hard to get in other languages other than Spanish. But they do have Vietnamese, they have French, they have Russian, another of other languages. They have video if the patron wants to watch video. Some of them are even surgery videos. Believe it or not, people do actually want to watch surgery videos. I'm not sure why. It's a little morbid, but they do find that interesting. Or drug information. One of the challenges in getting more health literate information is pharmaceuticals. Their way of thinking is CYA. So they're going to give you, if you've ever gone to the pharmacy and gotten some medication, and they give you that 3 or 4 page handout, and most of us throw it away. That's just because they feel like rather than giving you what you need to know and what is important to know, it's more, let's give everything but the kitchen sink. Another great thing about Medlineplus is particularly with drug information, is if there's something particular about that drug that there's been a recall or something you need to be watching out for, there's a big red box at the very top of the screen when you go to look at it, and it says, hey, wait a minute, you really need to take a look to make sure you're not having these interactions. See, in this one, we don't have anything, but because there's nothing, there's no recalls, there's nothing like that. So that's good to know that if there's something that, hey, stop, look at this, read this first before you proceed. That way they can be alerted to, hey, there's a recall, or there have been reactions that you need to pay attention to, and things like that. So that's really great for drug information. The great thing about Medlineplus, I always call it its own search engine, because it's pulling from not just the National Institute of Health's information and all of their organizations, such as the National Cancer Institute. It's also coming from kidshealth.org, which I'll talk about a little bit more later. It's pulling from the American Cancer Society, American Heart Association, other entities that are outside of the NIH, Boston Children's Hospital. It's taking the creme de la creme of health, consumer health information, and putting it on one website, which is just really amazing. A lot of people will use WebMD. We saw in Beth's searches that it was one of the first things to pop up, and I'm sure they paid quite heavily to have it optimized by Google. It is not my go-to resource. I seldom ever go on WebMD. I don't encourage other folks to go on WebMD for a number of reasons. One is they are heavily supported by advertising, a lot of them drug companies. And unfortunately, when you have an organization that is supported by advertising, it can create bias in the information. The hits that you get first may gear you towards one slant versus a mixed bag of what's actually available and out there. And most people are going to click on maybe the first 2 or 3 and they're done. So that's one reason. The other is not as easy to navigate as Medlineplus is. So if you have a user who's not computer savvy, they can easily go down a rabbit hole and can't get themselves out of it. And this is just so much easier for them to use. WebMD also doesn't provide as many documents in other languages as Medlineplus does. And that can be a challenge for people who don't speak English or read English. And the other reason is I have a problem when you can plug in your symptoms and self-diagnose. As Beth mentioned, we are not in the business of diagnosing folks, and they shouldn't be in the business of diagnosing themselves either. When I get families that come in and ask me, here's what we're being told, here's what I'm finding, what do you think? I always tell them, I said, this information is not for me or you to use as a diagnostic tool. This is a conversation starter with your healthcare provider, whether it's the nurse at the bedside, if you're more comfortable talking to them, or your physician. This gives you the tools to ask better questions. And so what you should be hearing and seeing. And, if you have questions about something, hey, please explain. I read this. What does this mean? It's a dialogue between you and your healthcare provider. And that's all it's intended to be. And usually they are 100% okay with that. They never come back at me and say, well, what about they're like, oh, okay. And nearly all good health literacy documents will have a disclaimer at the end for consumer health, that this is not to replace a physician visit. You nearly always see that disclaimer. Medlineplus is also the latest information. You're not having to worry about things being out of date, dead links. I don't think I have ever encountered that when operating through Medlineplus. It's just my go-to website. Any questions about, I'm sorry, I'm not being very good about looking at the chat, about Medlineplus or anything else?
It looks like there's a question about setting up alerts about medications being recalled, which I don't know that you can do via Medlineplus.
Yeah.
You know better than me. And then a question about COVID vaccine rollout. And that's, it's state by state. I mean,
Right.
federal initiative, but it's going to depend on what state somebody's.
Yes, for sure. There isn't, unfortunately, because the COVID vaccine rollout was not a federal national rollout. It was handed off to the states. There's no way to know from state to state how that information is going out, how to enroll. It's just, it varies from state to state, unfortunately. Hopefully.
Go ahead. I was just
going to say, hopefully this was a we're probably going to have another pandemic, and hopefully this was definitely a learning tool that, having a federal rollout has its advantages. So,
if you're in North Carolina, there is information through the state government websites about how things are happening in North Carolina. So there's a lot out there about that, but just not a national source.
Right. Medication alerts, I don't think you can get kind of alerts from Medlineplus. You can set up, but it's usually more like an RSS, a news feed. You can set up an RSS feed where it just gives you the latest kind of news. Unlike some, if you're looking at professional information through Ovid, Medline, and Pubmed, you can put in a search topic and get kind of the latest studies coming out around your topic, but not so much with Medlineplus. It's it's more kind of general news RSS feed, I think. Any other questions about Medlineplus?
Question about the drug information in Medlineplus for a medication that they looked up has not been updated in over a year, and is that necessarily a problem?
No. They're very, very good about keeping things up to date. The rule of thumb typically with consumer health information is if anything, it needs to be at least 5 years. You can go back 5 years. 3 if it's cancer information. And that's just because it takes a long time for the stuff to get updated. Most sites will at least review it and will put a review date on it, but doing something within a year is not uncommon. And if there has been no movement within a particular topic, you may not even see a review date. It just depends on the organization. Medlineplus is just kind of, like I said, it's almost like a search engine. It's just getting it from all these various organizations, and it's up to them to update their own information. But a year old is not uncommon at all. So, and with and there's certain topics that I would say with mental health, you could easily see something only updated every 5 to 10 years, and it still be good information. It just depends on growth and development. That hasn't changed over the centuries. So a lot of times you won't see anything about growth or childhood growth or development change as far as information.
And somebody just added on, I don't know if it was as much a question as, if it's been around for 10 years. If it's like penicillin, there may not be drug updates because we know what it does, and there probably aren't any alerts for it. So.
Right. Okay. Another site, you actually can, the information can come through Medlineplus as well, but sometimes I will immediately go to Kids Health. And this is pediatric specific. So as you can tell, I'm a pediatric librarian and I live in the peds world 24/7. But this is a really wonderful website for a number of reasons. One, nearly every article is also available in Spanish. You can also auditory. Let's even try looking at asthma, something real simple. Let me say real simple, and asthma actually has its own center because there's so much information about it. But let's just look at maybe asthma basics. Click on that one. That one's good. And as you can see, the article at the top right, or kind of near the top right, it's available in Spanish, so they could print it off in Spanish. But one of the great things Kids Health has done is they also made it auditory. Nearly all of their documents are that way. So you can go to listen and it actually will have somebody read the article to them, which is awesome because you have a lot of people who maybe don't read very well for whatever reason, or maybe they're just auditory learners. They learn better when something is spoken to them versus actually reading it. So that's really amazing as well. And then the other great thing about Kids Health is it is divided up into information for parents, for kids, and for teens. There is one for educators, teachers, if they want to use this in the classroom, but I usually focus more on whether this is for a parent, a kid, or a teen. And what is really amazing about this as well is that, let's say you have a parent who really only has a 5th grade reading level. And I could easily pull up an article for a child that's intended for the child and give it to the parent. And it's something that's really written at a level that they can understand a lot better. So it's really kind of just why I wanted to highlight Kids Health. If you had a patron who was specifically looking for pediatric information and that's where they wanted to start. It's really, they have games for kids so kids can learn more about. They have like that little asthma movie. It's animated, and so it's a lot easier for a child or someone who has reading difficulties to kind of learn about asthma. So it's really just an amazing website. Any questions about Kids Health? Trying to make sure we don't go over time here. Easy articles to print off, and then they can change the font and all of that as well. So those are kind of my 2 go-to websites that I use a lot. One of the things that I also wanted to mention is where we're going with health literacy. As I said, more and more organizations are trying to put out content that is more health literate. We still have a really long way to go. But we did have back in 2010, I don't know if people are aware of it or not, the Plain Language Act of 2010, which means any government document it doesn't matter whether it's a health document, it's your tax return. If it is produced by the American government, it has to be written at a level that people can understand. They didn't necessarily specify specifically 5th and 6th grade reading level, but they did say it had to be in plain writing. And this goes from anything from website content to a handout, has to be written in plain language. And I provided several links that can kind of help you start to understand plain language. Plainlanguage.gov is an amazing resource. They give you lots of good information about the history of plain language, the guidelines. We at Atrium Health are shooting for 5th and 6th grade reading level. Most places are shooting for at least 7th grade. We'll see how long it takes. I mean, we're already 10 years out from when this act went into effect, and we've still got a really long way to go. I don't know if you guys have ever visited the CDC website, but if you have, you can understand that there's a lot of content on there that is really complicated and not necessarily for consumer consumption. Yeah, but they're working on it. So hopefully many of these websites will start to get much better. There's also the Center for Plain Language is another great website that talks about plain language and what that means. Really just outstanding website to learn more about plain language. And then there's the FDA actually came out with plain writing, the law, and then their guidelines, the principle, which is interesting. The FDA was one of the first organizations to start writing easy to read documents. Again, just your basic health documents, you know, what to do if your child has a fever kind of thing. They also started targeting immigrant populations, migrant workers and stuff like that. So who, again, English is probably not their first language. So the FDA was one of the first organizations to really start working on this, interestingly enough. But hopefully, you know, if you're interested in learning more about plain language, you know, these are some websites to go and check out. It also kind of helps us, you know, kind of keep track of our U.S. government, and are they really following through with creating documentation that people can easily read. I know a lot of times, especially if it's legal documents, you get a lot of pushback from the legal community about, you know, again, it's a CYA thing. You know, we want it to be written in a certain way so there's no mistaking what we mean, and this is the legal jargon and the legal tone. And even in healthcare, we get a lot of pushback from our risk management and legal team, and we're like, but if they don't understand what a DNR is, then how is that helpful? And for folks who don't work in healthcare, DNR is the do not resuscitate, which a lot of times if you're particularly going under anesthesia or into surgery, they'll want you to know, you know, what are your wishes. And we have particularly elderly folks who don't, they'll read that and they're like, I have no idea what that means. And, you know, that's pretty important. You know, if you want to be resuscitated, should something happen, or you don't, or you have a power of attorney, a lot of times they don't understand that legal language and what does that mean. So it's not just about, you know, health healthcare and how do I take care of myself, it's also about the legal documents that surround healthcare or surround anything we do in life, really. Any questions about plain language? I hope I've explained things well enough. It's sometimes hard when you live it and breathe it. I actually am the chair for pediatric patient education and do a lot of health literacy editing when they're creating documents within our system. And it's so second nature to me now to write at a 5th grade reading level. And when I come back with, okay, you need to change this, this, and this, and they're like, but that's so simple. I mean, I was like, exactly, that's the point. Or they're shocked when they send something to me and I say, this is actually written at a college level. And they're like, oh, no. I was like, yeah, it is. And here's how you got to change it. It becomes, once you start really looking at it through the plain language lens, it becomes pretty obvious how things should be written and presented to folks who don't live and breathe healthcare.
Well, I'm not seeing any chat questions. I'm not going to spend a lot of time on this, but I am going to go over some of the professional level resources. I think just because some of you mentioned, particularly like nursing students that would come into the library, people who need to use professional level resources. So what's available out there through just NC Live and online.
Hey, Beth, you're muted.
Oh, thank you.
Mm-hmm.
So sorry about that. I want to talk about some of the professional level resources because some of you mentioned resources for, say, a nursing student that comes into the library and needs to find information. So there are 3 that I want to show you quickly in NC Live, Cinahl being the main one. Cinahl is where I would take a nursing student, for example, that needs articles on their PICO question that are in a nursing journal. And you have access to that through NC Live. Learning Express, a lot of people come in looking for test preparation resources and practice tests. And depending on the exam that they're going to take, there are a lot of those in Prep Step. And then Credo Reference. So there's a lot of background information, kind of like where you would go to a traditional reference shelf in Credo. So just to show you a few of those, we'll come back to the freely available. But if I'm in NC Live and I just do a search for Cinahl, it's CINAHL Cumulative Index to Nursing and Allied Health Literature. So if we go into Cinahl and let's see, for example, we were talking about DNR. So if this is somebody's paper topic, I'm just putting some keywords in here and clicking search. I have over 10,000 results. So the first thing you always want to do with the Cinahl search is this goes back to 1957, which we don't want. And let's go back just 5 years. So since 2021 is, we're only 2.5 months in, I'll go back to 2015. So that really reduces what we get back. And say they need this article in a nursing journal. This assignment is kind of arbitrary and I don't love it, but I've seen it a lot of times. So underneath, I went here very quickly. Right underneath that date slider over on the left, you have show more. So usually I do my keyword search first just to see what's out there. But then you have all of these limit options, and one of them is journal subset. So if I go into that journal subset menu, if it will let me, I have the option to choose nursing here. I have to scroll down to the bottom and click search to choose that option. But that will give you just articles in nursing journals. And might use quotation marks there since I'm finding things that aren't necessarily relevant up at the top of the list.
Hey, Beth, can I show you a good trick? This is Julie.
Tell me.
Scroll down in the left column past your full text and your date and all of that, and find the publication and expand that and show more. And then I just pick the nursing journals out of that because I get that assignment too.
That will work. And then up at the top of the list, you go to page options and choose detailed. As somebody's looking through, so they know whether or not they actually want to go look at this article, they might want to choose detailed. If it will let me, there's a select button down at the bottom of that menu, but they can limit or they can display detailed results, and that will show the abstracts. So that'll give them some idea of whether or not they want to look at it. So I'm going to back up out of Cinahl for just a minute and go to Prep Step, or it still says Learning Express in here, but I think they're in the process of changing the name for this to Prep Step. And this is where those test preparation resources are. And so, for example, if I go to Public Library, in career preparation, there's this option to prepare for nursing exams. I have to click again to actually get there. But like the TEAS test, which is pretty common for nursing school entrance, nurse aid certification, NCLEX, RN, and PN. There's some further up for various allied health fields. So just be aware that this is there. If somebody's looking for a test prep book, this actually has a lot of practice tests in it. So that's something that you can guide them to. And then Credo is more like your shelf of reference books. Well, I'll try this one more time and then I will let you go explore it on your own. Let's see if I click here, if it will take me there. So there's a whole health and medicine section here. A lot of topics. So let's just look at nursing ethics, kind of picking at random out of this list. But this is some good background information. So when you're researching a topic in nursing, there's foreground information, like when you come up with a PICO question, evidence for what you're looking at, like the outcome that you're looking at, is your intervention or the thing it's compared to more effective? But before you get to that, and before you even come up with your question, a lot of times you have to gather background information, and Credo can be helpful for that. It's an alternative to just doing a Google search when you're in nursing school. And things that are freely available. So all of you are hopefully familiar with PubMed. We looked at it briefly earlier. The one thing I would mention about PubMed is it's freely available. Anyone can go to pubmed.gov and search, but there are millions of articles in it. It's primarily a database, an indexing database, citations and abstracts. So if people need to get to full text, try to redirect them to the PubMed that links to their schools or their institution's journals. So if I were taking a UNC-Charlotte student to PubMed, we would go through the databases page, or they can get there through the learning management system and Canvas. But if they have access to PubMed that links to journals, I would take them there. And CDC, we talked a little bit about that as a resource, but there's some specific things like, I'll put in growth charts. Angela can probably correct me. Like there's some that they recommend using WHO, and there's some that are for the US. But if I go here we go. And they even spell it out. Use the WHO growth standards to monitor growth for infants and children ages 0 to 2 in the US. So they link out to that. But there's some very specific pieces of information that you would get to from CDC, in addition to the general information that you might go looking for. Some other free resources that I would mention quickly: Trip database. Like PubMed, you may not be able to get to all of the articles that are linked here. It doesn't have the option to link through your institution, but there is a PICO search. So you can look for things here and then go see if you have access to them. There's Pedro, which is a physical therapy evidence database, not Pedro Pascal. So if I go here, sometimes if you find a physical therapy intervention here, it will evaluate the evidence. Some of the more recent ones, I didn't find that, but that's a resource that you can direct people to. And then I just quickly mentioned Healthy People 2030. If somebody is looking for a topic that's health related to research on, especially these leading health indicators here, this is what a lot of research and interventions are going to be targeted at for the next 10 years until we reach 2030. So some of the leading health indicators here would be good topics to recommend for someone to research. So I have a few questions. We only have about 2 minutes left, but let's see if there's anything in chat. So Medline Complete and Medlineplus. Yeah, Medline is, that's information intended for biomedical and health researchers and students. It's written at a professional level, and Medlineplus is more the site for consumer health information. Credo can be good to find background information on a health topic. Healthy People is great if you just need to find something that there's going to be a lot of research and attention paid to in the next 10 years. Credo does have a really neat mind mapping tool that I obviously don't have time to show you right now, but that can be really cool. When you type in a keyword in the mind mapping tool, it will map to related topics. And that can even help a student who's trying to sort of structure their paper, like come up with a thesis question and then have related points. And yep, somebody else answered them. Angela answered the Medline question in chat. So I think we've addressed that one. So this is maybe a take home rather than something we can work through together, but just where would you go to find these pieces of information based on what we went over? And that's basically all I had. Angela, do you have anything else you want to say to wrap up?
I did think of one more resource as we were going through. NORD database, N-O-R-D. It's an amazing database for rare diseases. Sadly, the information, and it's really the nature of the beast, is pretty high level. Most of it's written at a high school or college level. And it's if you look under patients and families, you can either type in your search topic, and then on rare disease information, you can just do a simple little browse search. Not every, I mean, if it's extremely rare, it may not be in here, but most of them would. Maybe let's try DeGeorge syndrome. Let's see, that's in there. This is just one, it's DI. Sorry. Let's see.
I'm not seeing it, but
Hey, Angela, I think you're muted.
Sorry. Dandy Walker. If it will give you the list of other names it may go by. And if you scroll down, it's a pretty comprehensive article on the disease. And then at the end, it will give them resources, whether it's, organizations that can help with support, other organizations that have information. And then a list of citations as well. So just a great, and references, just a great place for rare disease information that's not often going to be found in Medlineplus or Kids Health, just because of the nature of the information. So I wanted to throw that one out.
we can add that one to the slides.
Yeah.
That's great. Any other questions from the participants?
Mayo Clinic, yes, very good. You can actually also get a lot of Mayo Clinic information from Pubmed. Cleveland Clinic, Boston Children's, Harvard Medical School are some of the top.
All right, well, if there are no additional questions, thank you so much, Beth and Angela, for taking the time to cover this topic for us today, and provide so many good resources, non-NC Live and NC Live resources. Folks, keep an eye out for that follow-up email later today with the slides and the survey and the recording. Just a heads up, we have a couple of other webinars coming up this week. So I'll include a link to our training calendar. There's a afternoon with Tracy Hall, the head of ALA, on Thursday, as well as a Canva for graphic design and marketing webinar on Thursday as well. So feel free to check those out as well if you're interested in other training opportunities. And with that, have a great rest of your Tuesday, and stay dry out there.
Thank you.